These are the three most common suture types I use in the emergency department every day as an ER doctor. The first type is the most common, a simple interrupted suture. As you can see, we pass it from one side to the other, wrap twice around the needle driver, and then close a loop. After that, we're going to apply several one-wrap knots on top for additional strength. This suture type is appropriate for most wounds we see in the emergency department. Please excuse the lack of sterile technique. In this case, I'm sure our patient will survive. The second most common suture type is a horizontal mattress suture. This suture is particularly useful when the wounds are gaping open and require a lot of tension to hold them closed. After going from one side to the other, we're going to reverse course and go from the second side back to the first. Then using the same technique, 2 wraps around the needle driver to close the loop, followed by several subsequent 1-wrap knots on top for additional strength. The third most common suture type I use every day is a figure of 8 suture. As you can see, you go from one side to the other, just like the simple interrupted, but now you're going to make a second pass from the original side to the second side. This suture type is particularly useful when you have a bleeding vessel or varicose vein that won't stop bleeding. Just like before, 2 wraps around the needle driver to close the loop, followed by several subsequent knots to provide additional tension strength. This is not an exhaustive list, but these are the 3 most common types that I use every day in the emergency department.